Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and today you've caught me a little bit upset. In last week's Friday Focus video, I talked about why I recommend not getting teeth extractions for orthodontic treatment. Since that video has gone live, I've received a number of emails for people asking me to review their orthodontic treatment. You know, after I reviewed some of these orthodontic cases, I've started to wonder why some of the people are even being properly treated. Let me explain. In one case, I saw photos of a patient who had teeth extracted, and they clearly did not need the extractions. All they needed was treatment which would create the space needed to move the teeth. In another case, I saw photos of a patient who had been recommended extractions, and luckily they came to me for a second opinion prior to getting the extractions, and so we were able to avoid them. Let me be explicitly clear. I would say 95% of extractions are not necessary. A good orthodontist who can straighten your teeth without extractions if the treatment's properly planned. When someone recommends extractions to you, ask the following questions. Why are they extracted? Is there another way to achieve the goal? Worst case scenario, if your orthodontist can't give you the right answer, seek a second opinion. Now here's why I believe that extractions are not necessary. You know, if you take a child, and we're going to talk about children. If you take a child early and you do an orthodontic screening at the age of 7, which the American Association of Orthodontists recommends, if you're proactive about creating space, you can start to create a level, like a playing field for all the adult teeth to fall into. And so, like in our office, we do a lot of early treatment, and I'm tired of people telling me, well, early treatment, I'm only here to try to get more money, or I'm trying to, like, it's not necessary. Listen, there are so many reasons that you should do 2 phases of treatment. And a lot of times it's mitigating risk for the need of extractions. Sometimes it's improving the overall outcome. And so, listen, for every doctor that says, oh, you don't need to do it, I can show you a case or a person's treatment where, had we not done early treatment, or had we not done the treatment without pulling teeth, we would have had an unfavorable outcome. In children, when we do treatment, and you sometimes forego the phase 1 treatment, sometimes you can end up having gum issues, you can end up having the need of teeth being taken out, adult teeth. And in cases where in adults, right, or even worse, even with children, if you take out teeth and you flatten a child's profile, or you flatten an adult's profile, and you thin their upper lip, they're going to end up freaking looking terrible. And the whole goal, or the whole premise when you come into the orthodontic office is, yeah, you do want straight teeth, but inevitably you want to look better. And so I'm just really being cautionary to you. I'm not saying that extractions there isn't a place for them. All I'm saying is that but there are ways that they can be avoided very simply. And so if you're very proactive in kind of looking at this, and I'm telling you, it's not necessarily you're always going to find the answers on the internet or in the literature. Like, when you see it clinically, when you see, like, oh, I can make a difference with this kid. Okay, I created space for the canines so that the canines didn't have gum recession around them because they didn't come in like a fang. Well, like, people when they do orthodontic studies or treatment, they're not looking necessarily at that. And so, and I'll just leave you with one last story. You know, we had a local orthodontist, and they were interviewed by a local TV affiliate. And what was really interesting is they said they do about 85% of their cases in phase 2 treatment or complete treatment. Only 15% of their cases finish out in phase 1. They do in phase 1. And the crazy part about that story is that the person doing the interview didn't have the appropriate follow-up question. The follow-up question should have been, out of the 85% of patients that you don't treat with phase 1 treatment, of that percentage, how many of those people do you extract? How many cases, what percentage of the people, of that 85%? So if you have 85 people, you have 100 people who get treatment in your office, and you say you only do comprehensive treatment, 85 of them, how many of those do you extract on? If it's the national average, it's about 50%. So there's 40 people who are going to be subjected to some type of extraction therapy. And so when someone asks me, well, what's the risk? That's the risk. And that's why typically we recommend phase 1 treatment, is because if I can avoid that being part of that percent of pool of patients, that's what I want for my patients. That's what I want for people who get orthodontic treatment in my office. And so, listen, we're here. You can reach out to us on our YouTube channel or our Facebook page. If you have questions about orthodontic treatment, your orthodontic treatment, and you want a kind of an impartial view, give us a call or drop us a line, and we'll try to answer as many questions as we can. Have a great weekend. We'll see you next week at the next Friday Focus.